Does the USDA give healthy nutritional guidance?
I've actually been in meetings with the USDA. I find them very willing and able to listen. And if you make a good case, they will try to change the information that they're putting out. They do run a process every 5 years along with the Health and Human Services to try and give guidance to the American people. My concern about it is that they, just like I was able to go and meet with them and discuss my point of view and the point of view of the American College of Cardiology and Nutrition work group. Well, everyone else does it as well. And so if you live in a society with not just free speech, but financially motivated advertising, you're going to see some things that are not good for our system get into the USDA guidelines, and you'll see them on television commercials, and you'll see them pretty much everywhere. And if we could get everyone to stick to large randomized trials, number one, and the second level of evidence would be the large long-term prospective non-randomized data, and sort of use those for guiding our nutritional choices, I think we'd be better off. The USDA has a tough job, and some of it is, I feel, hurt by congressional subsidies that have been there for a long time. And I know the USDA is not happy about putting out a document saying, less refined grains and less processed meat and less sugar sweetened beverages, and then find out that that our congressional subsidies are actually promoting the production of those things.
From a health standpoint, should we try to add oils such as flax, hemp, and olive oil to our diets, or should we try to avoid it? If we do use it, should we avoid heating it up?
So it's interesting that heating even at high heat was said in the past to cause popping of double bonds. So for all the chemists in the audience, that means taking your unsaturated fat and making it more saturated. When I looked at the more recent trials, they say that pretty much isn't true. I mean, you could, particularly if you're using it below the smoke point. Now, having said that, are we really benefiting the blood vessels? Probably not if you're using them in these oils in large amounts. And so I would say, maybe minimizing them, or, if you don't have to avoid them, you certainly should decrease it to a small amount. And the high heat, I think the jury's still out on that, because I was shocked to find out that what I've been telling people about the fat becoming more saturated apparently doesn't have a chemical basis. So let's keep an open mind on that. And again, if you're overweight, just remember that any oil that you eat is likely to be stored. So let's be really careful with it.
How do we know if the benefits of a medical treatment or test outweigh the risks, and who should we listen to?
It's a really good question that people have to wrestle with. Just I've given some examples, such as, niacin, which we thought of as something that was so benign, it's just a vitamin, it's going to help people. Great. It turns out large doses of niacin that were supposed to increase our HDL cholesterol, the happy cholesterol, the healthy cholesterol. It turns out that large randomized trials showed that they increase mortality. And we were kind of shocked, and then we realized that HDL itself, two large trials, the CanHeart from Canada and Copenhagen, both said that we had it wrong for 60 years. A very high HDL cholesterol does not protect you. It actually increases heart attacks. And so to whom should we listen? We have to keep an open mind. We have to drop our ego at the door. We have to not be dogmatic, because half of the things that I learned in medical school actually aren't true anymore, because we have better evidence. We start off with individual experience, and then you have a small trial here and there. But all of those can be overturned and change our guidelines, because of large-scale randomized trials, which we don't quite have enough of. And so in the guideline business, in the clinical practice business, your own personal health, you try to use the best evidence that you can come up with. And the guidelines that we put out for prevention, for example, 2019 American College of Cardiology prevention guidelines, are there for everybody to read. And you'll read a nutrition section that says that people should be doing mostly plants. And there's a nice section with references and talking about the strength of the evidence to support that. So I would say that the jury is always out. Medical knowledge increases or doubles every couple of years. And so sometimes that increase in knowledge is undoing things that we thought were true that just were not. And so let's just be humble and open-minded.
Why was it important for you to come back and speak here at the Real Truth About Health conference?
Really happy to participate. The major issue that I see facing Americans is that we have nutritional deficits in our brain. They're ingrained from society in our African American community. It's inherited from even our slave days. And people talk about trying to get away from the kinds of things that were for survival in the past, and now they're decreasing our longevity. But it's not just about our minority communities, it's about our entire system, because we have to take a stand for nutrition. We need to make sure that everyone understands the benefits of our medical system and the deficits. It's very expensive. We're constantly putting out fires that shouldn't have been started, mopping up the floor, as people say, instead of turning off the faucet. And we need to be incentivizing prevention. And sure, I'll keep talking about that with Medicare and with our government agencies, but at some point we have to take individual responsibility. I know that people didn't generally wear seatbelts until they were legislated, and click it or ticket makes a difference. And maybe that's what we need in terms of nutrition and exercise. But at some point, people would, if you want your personal freedom, you have to make sure that you as an individual are actually doing the things that are beneficial to your health. And so I know I've said it many times, and I'll keep going with it, that it's not just for you. That is, I don't, excuse me, I don't know too many patients. I have a few, but not too many patients who are so isolated that their health does not affect someone else. And so I feel like it's my personal duty to my kids and my family to make sure that I'm healthy and not a burden to them. I don't want them to have to take off of work seeing their patients to take me to a hospital. I think that would be, if it's due to choices that I've made, then those are selfish and uninformed choices. And so we have to commit to ourselves, our own health, commit to our families, our communities, and our nation. And again, it's our patriotic duty to do so. The time is now.
Well, we thank you for your time and all of your meaningful work, and for sharing all of this with our audiences.
Thank you so much for having me.
Absolutely. Good to see you again, Doctor. Be well.
All right. Take care now.